Hello, my name is Stavropoulou-Tatla, and today I'll be presenting my quality improvement project on improving healthcare staff knowledge of the NG 179 NICE guideline on elective surgical care during the COVID-19 pandemic. This project was carried out at the Royal Free Hospital in London. A little bit of background. So during the first wave of the pandemic, several countries issued guidance postponing all elective assessments and operations, leading to an estimated backlog of nearly 28 million cases worldwide. In the UK alone, over 4 million cases were postponed, likely leading to an associated increase in mortality and an estimated cost of 5.3 billion to the national healthcare system. After the end of the first wave, elective surgical activity was gradually resumed. In an attempt to regulate this, NICE issued the COVID-19 Rapid Guideline. The aim of the current project was to increase the healthcare staff knowledge of the aforementioned guideline to a targeted score of 100% in the disseminated questionnaire within 3 months. During the first cycle, the visual summary of the guideline was visibly placed in all relevant clinical areas. During the second cycle, brief weekly small group teaching sessions were held on all the medical and surgical wards. You can see the results in figures A and B. Figure A shows the mean percentage score in online questionnaires, which increased significantly from 51% at baseline to 81% after PDSA 1 and 93% after PDSA 2. Figure B shows the improvements in healthcare staff knowledge per domain tested. Importantly, domains which showed the greatest improvements included the testing and self-isolation requirements for elective operations. The main limitations of the current project were that the sustainability and the impact on healthcare systems of the results were not directly investigated. Thus, our future work will focus on assessing if the improved healthcare staff knowledge is maintained, and hence how frequently refresher sessions would be required, and also if it has an effect on hospital performance outcomes, such as the cancellation rate of elective operations. To conclude, the targeted distribution of guideline printouts and visual aids, combined with small group teaching sessions, were simple and effective ways of educating healthcare staff about the new standards of elective surgical care during the COVID pandemic. This has the potential to facilitate the safe restoration of surgical activity, which could mitigate the far-reaching consequences of surgical delays and cancellations on an unprecedented scale. Thanks a lot for listening.